Hello, my name is Christy, and if you're viewing this video, then unfortunately, you or a loved one has experienced a brachial plexus injury, also known as a BPI. You may know that this is an injury to the network of nerve fibers between the head and the neck that supply signals to the muscles in our shoulder, arm, and hand. The injury occurs when these nerves are stretched or torn. Such injuries can occur from contact sports, falls, or trauma from motorcycles, even scooters, or bullet wounds, tumors that put pressure on brachial plexus nerves that have been damaged by radiation therapy, sometimes even difficult births. But healing from a BPI can be a frustrating and lengthy process. A process is a series of activities that over time interact to help produce maybe a desired result. Every patient's BPI healing journey may be different, but often adversity can show us that we're stronger, more resilient than even we know. Some problems, hopefully temporary ones, from a BPI, which could include stiff joints, which can make movement difficult, numbness, and/or acute or chronic pain. And muscle atrophy can occur when a lack of muscle use causes our muscles to break down. I experienced a BPI, which caused a total paralysis of my right arm, wrist, and hand, but now I've begun my second year of recovery. And though I have more therapy work to do, I want to share with you today that I've come a long way and may continue to improve for another year or two. I really hope this video will be helpful to you. And today I'm going to mention the important basics for me of a 4-step BPI recovery process, which includes proper imaging, therapies, pain management, and good relations with your doctors. And to new BPI patients deeply concerned about your recovery, like I was, I say to you what one of my two excellent physical and occupational therapists, Susan and Karen, had said to me during only my second therapy session. I am so sorry for what happened to you. This is a tough time, I know, but I want the moon for your recovery, and you'll even be able to peel a potato again. Apparently, I learned peeling a potato was a high priority for some BPI therapy patients. There are about 200,000 such injuries per year, and how well one recovers from a serious BPI depends upon the type, the location of the injury, severity, even your age matters. But if you stick with the therapies and the follow-up of your specialist doctor care, you too can progress in your recovery. Hopefully today you're ready to hear some harsh truth, that nerve tissue grows back, but slowly. You can expect about 1 millimeter per day or 1 inch per month. In some cases like mine, where the nerves were jumbled and stretched but not cut, therapy and time has returned many functions and some feelings. My shoulder, elbow, and forearm are back about 90%. Yay! I've learned that being able to lift and straighten my arm and make a good fist is important. My fingers can now make a fairly good semblance of a fist. Yay! So the surgeons felt I've been making really good progress on my own without surgery. But if BPI surgery is warranted for you, please note that it may take up to 3 years to realize full benefits of the surgery. In the meantime, you may experience mild, moderate, or severe pain, tingling, numbness or weakness in the arm, loss of sensation, or even diminished reflexes. Yes, my recovery so far has taken time, and it took me developing patience to let my body heal, patience to learn how to do the right combination of treatment therapies for me. Please note that therapy itself can be challenging physically, psychologically, and emotionally. Not only the injury, but the healing therapies can initially be quite painful. As mentioned, healing from BPI is a process, but some quit the healing process too soon, so please don't do that and take it step by step. I was continually told that for sure we had to keep both my muscles and fingers and joints limber so that they will be able to move when the affected nerves awaken and come back. How did I get my BPI, you ask? In March of 2020, at the start of the COVID pandemic in my state, while I was COVID-free, I had an incredibly stressful day and was not feeling well. So contacting my family doctor, he ordered me to have emergency stress testing at a local hospital to rule out if I was having a cardio event. We found out later it turned out I was not. But in the emergency room COVID craziness, I was required to put on a face mask, which I didn't know how to do and did not fit me well, and I was required to sit in a wheelchair when I was whizzed down the hallway. And then suddenly I was instructed to step up to the weight machine. I complied, but however, in the craziness, the attendant, new to the emergency room processes, did not lock the wheelchair. It was an accident. So when I stood up, the chair rolled back and I caught my foot on one of its footrests, and I went airborne. With much force, I tried to stop my fall from the unlocked wheelchair using my right arm. But while the astonished staff looked on, I landed hard on the cement floor, sustaining a fractured humerus bone, a dislocated shoulder, and immediately paralyzed right hand and fingers. According to the x-rays in the hospital, the brachial plexus near my neck had become stretched and tangled, so I'd lost the use of my arm, wrist, and hand. But the purpose of this video is not to dwell on my accident. No, the purpose is to say I am healing well and getting through much uncertainty, and I wish to offer new BPI patients real hope and motivation for their good recovery. While each BPI patient's injuries, situations may differ, by sticking with the therapies, your healing can occur. Now, you will likely be told countless times by well-meaning healthcare professionals that every patient's healing is different, the timing of recovery and response to it, and therapy outcomes can be uncertain. This is a frustrating answer, I know, and it was given to me frequently when I'd ask such BPI questions. They probably don't want to overpromise to us or give us unrealistic false hopes. Doctors will probably want to wait and see how your body is healing initially itself before recommending any surgery. My hubby and I were continuously advised to keep my joints and muscles working daily and maintain a range of motion and prevent stiff joints, especially in one's fingers and shoulders. So when my nerves finally did awaken, we'll be ready. Because these nerve fibers heal slowly, as I've mentioned, the doctor's wait-and-see time approach for you may be up to 1 or 2 years. But I'm happy to share with you today that I've made huge progress. My arm and even my hand are coming back nicely from where I started, which was like 0. Believe in the healing process and accept some uncertainty. And have patience. This was exceedingly difficult for me. And borrowing from the old saying, the time heals all wounds, time really can heal some wounds. Time and you're regularly doing the treatments really will matter. In addition to my therapy clinic sessions about 4 hours a week, as instructed and with my husband's help, for a few months we practiced the therapies 4 times a day at home. But now I only need to practice home therapies once or twice a day. So let's begin today with the 4 basics of my BPI recovery process. Number 1, imaging and tests. To diagnose the type and severity of the injury, several tests may be needed, from x-rays through to magnetic resonance imaging and MRI. These determine the extent of the damage and assess the status of arteries, which are important for the treatment of your injured limb. Finally, when making appointments for this imaging, do ask if you need to stop taking certain medications prior, and be sure not to wear skin lotion the very day of your x-rays. My favorite test was the electromyography, the EMG. This evaluated the electrical activity of the muscles when they contract and when they are at rest. Now you may feel a little pain, and I'm a big baby when it comes to pain and needles when the electrodes are inserted, but most patients really complete this test, I'm told, without much pain. And at the same time, you'll get a nerve conduction test measuring how well the injured nerve is functioning. Now you'll be given a percentage of the function you currently have, and don't freak out about the first number. It'll probably be very small. At first, mine was at 0. 2 months later, it was at 50%, and so forth. And it's been my happy experience that after my EMG testing, for several days, I would actually regain more function, I guess from the electrical stimulation. After the test determined the severity and extent of the BPI, the injured limb will be immobilized temporarily. Note that while some severe BPIs do require surgery to regain activities of daily living, my doctors determined I probably would not need surgery. But possible procedures could include tendon and muscle transfers and nerve transfers. These are a way to also help access new nerve growth. Number 2, onward to the healing therapies. Physical therapy is most important, both the passive kind of exercises when the therapist moves your healing shoulder, arm, or hand, and the active kind. That's where once you start to regain control of a muscle, you start to do the moving exercises. Do you know the main difference between physical therapy and occupational therapy? I didn't. PT focuses mainly on improving a patient's ability to move your entire body. Occupational therapy focuses on improving a patient's ability to perform activities of daily living. Example, eating meals, putting on our clothes, brushing our teeth, pulling up our blue jeans, making your bed, and if taking new pain medication meds, as in your treatment therapy, you may learn how to walk without losing your balance because you can get dizzy from these pain medications. I found both types of physical and occupational therapies to be extremely beneficial. How often will you have to practice the therapies? It depends upon your injury. Everyone is different, yada, yada, yada. Remember, you're going to get very tired of hearing this. My progress started very slowly. I still recall that first day that my hand therapist demanded that I lay down and tie my shoelaces on my sports shoe and write my name on a piece of paper. Because I seemed to have no function at all at the time being, I thought she'd lost her marbles. But she continued to push me, and I muddled through. The next session, she even gave me homework to do. Learn to brush my teeth with my electric toothbrush for 5 strokes, make my bed, and comb my hair for 5 strokes. At first, doing these things, these simple things, took me a very long time. And with my perfectionist type of personality at first, attempts felt very frustrating. I thought at first I did them very badly. But you keep at these tasks. You will not be graded by a teacher if you do each slowly, carefully, even clumsily. It's fine. Eventually, my muscles got stronger, and I improved. I could pick up and transfer cotton balls and pennies, pick up a piece of paper from the floor, and squeeze therapeutic sponges and therapeutic clay, and squeeze and celebrate each. They indicate a returning function. Each is a big happy deal for you. Number 3, how to get relief from your BPI discomfort. Pain from a BPI can be described by some patients as mild or debilitating. Mine initially was severe, and I did need some serious pain medications to help me get through those first maybe even 8 months. I took hydrocodone, tramadol, etodolac, gabapentin, and even super Tylenol. In the beginning, when only tramadol was prescribed, it was not enough for me. But I had a hard time describing to my nurses that I needed something stronger. One nurse suggested large doses of Motrin, which immediately interacted with my already high blood pressure. Eventually, when my hand doctor told me he was not allowed to exceed a certain state limit on these pain medications, I agreed to and was sent to a pain management clinic where I got supervised help for my pain management for about another 4 months. I knew I was not going to get addicted to this pain medication because I'd never even smoked cigarettes before. My biggest addiction is Cape Cod potato chips, but still I had to become my own advocate for pain management that was appropriate for me. Eventually, I weaned off of all the pain medication and only needed 1 8-hour super Tylenol, and that was usually at bedtime. Cold contracts inflammation of a BPI. Heat can relax stiff muscles related to your BPI. Some patients get pain relief from BPI pain by wrapping that injured limb for a few minutes with a gel pad that was heated gently in a microwave oven for only about 30 seconds. Some get relief from a few minutes wrapped up in an ice pack. I use both. Splints include